Hey guys, at this point you already know the basics of the nephron structure. Now what we're going to do is we're going to get into the more specific details. Okay, so more on the nephron. So let's look at that glomerulus. The glomerulus, again, it's a capillary bed, and as a capillary bed, it has a lot of surface area. So you have a network of branching blood vessels. And remember that the function of the glomerulus is to do glomerular filtration. And filtration just means forcing liquids through holes. And so you have to create holes. Okay, so the glomerulus is what we call fenestrated. And fenestrated just means that there are large pores between the cells lining that make up the tunica intima of the capillary bed. And that allows those large pores to help with the filtration. And then the other thing that I need you to understand is that when you filtrate, you have to create a high pressure because the pressure gradient is what drives the filtrate through the holes. Okay, so remember that it's drained, it's fed by an arteriole, so the afferent arteriole, but then also drained by an arteriole, the efferent arteriole. Okay, and that'll create that very high pressure. Okay, so let's look at the capsule that surrounds the glomerulus, okay, also known as the Bowman's capsule. So here is the glomerulus here. So you do have there, right there would be the simple squamous epithelium that is lining the glomerulus, okay, the blood vessel. But then on top of that, in purple here, that's what we call the visceral layer of the glomerular capsule. Okay, so if you think about how it surrounds it, it has the visceral layer, and we've seen that word visceral before when we talked about, remember, serous membranes. You have the one that closely lines the organ. That's the visceral pleura, for example, closely lining the lungs. Okay, it's the same idea here. So we have the glomerulus, which is a knot of blood vessels, and then directly kind of stuck on the outside of that, that would be the visceral layer of the glomerular capsule. And then not touching it, so on the outer layer of the capsule, that would then be the parietal layer here. So here is the parietal layer there, and this is the visceral layer. Now, the visceral layer of the capsule has very highly modified specialized cells, and those specialized cells are called podocyte. Cyte meaning cell, podo referring to a pod, which is a foot. Okay, and it's because these are called podocytes because these podocytes have these long cellular processes, so these long branching processes, and at the end of these branching processes, they have these little extensions, okay, these little feet-like extensions, and they come very close together to create what are called filtration slits. Okay, so if you're looking at this picture here, here is the capillary, so the glomerulus capillary bed, okay, so the blood vessel itself, and it's fenestrated, so it's got large pores in it, makes it very easy for things to be forced through it. And then sitting on top of it are those podocytes with their long branches that create these little foot-like processes that come together to make the filtration slits. And so the liquid is going to be forced through the filtration slit, and it creates what's called a filtration membrane. So the filtration membrane is made up of two structures. The first is just the glomerular wall. Okay, so here is just the outside of the glomerulus. Okay, so here's red blood cells inside of the capillary bed, and here is the wall of the glomerulus. It's fenestrated, so it's got little pores all in it. It's very holy. Okay, and then sitting on top of the outside, we have the glomerular capsule, the visceral layer of the glomerular capsule, which has those podocytes that create those long processes that make the filtration slits. And so now we have some nice, beautiful holes for the liquid, the plasma, and all the solutes in it, all the dissolved stuff, to go and be forced through it, and that's how you create filtration. So, awesome! Okay, then the parietal layer, Okay, so that one has those very specialized podocytes making those filtration membranes. And then the outside, so there's a little space right here. That's where the filtrate would be captured. And then the outer layer here that makes up the outer wall of the capsule, that's called the parietal layer here. And the parietal layer is going to be made up of simple, because it's one layer, squamous, because it's flat, epithelium. Okay, so simple, squamous, epithelium. Okay, where do we go next? From the renal capsule, we're going to go into the proximal convoluted tubule. Okay, so here we have the parietal layer, the renal capsule. Whoa, wait, no, we're going the wrong way. Parietal layer of the renal capsule. Then we're going to go into the proximal convoluted tubule. So both the proximal convoluted tubule and the distal convoluted tubule, those are going to be made up, and some of the thick segment of the loop of Henle as well. Those are going to be made up of simple cuboidal epithelium. So remember, simple meaning there's still one single layer. So looking inside the proximal convoluted tubule, this is what it looks like. You've seen this before already in histology at the very beginning. Okay, so one single layer of cubes or square cells. So that's why they're simple cuboidal epithelium. And then on the surface of those simple cuboidal epithelium, you have microvilli. What's the functional significance of microvilli? So remember, they're different from cilia. Cilia move, they sweep, sweep, sweep. All microvilli do is stick out. Okay, so the reason they stick out is because the more they stick out, the more surface area is created. And so remember that the function of the proximal convoluted tubule primarily is to reabsorb things back into the body. Okay, so think about how this works. To create urine, you have to filter the liquid through. So everything pushes out. And now we get to be choosy about what comes back into the body. That's called tubular reabsorption, or sometimes just reabsorption. What's coming back into the body, you're going to put it into the blood and you're going to keep it in your body. So if the job is to pull it back into the body, you want to make sure that there's not a very thick layer, so it'll be simple. And you want to make sure there's plenty of surface area to help reclaim and bring things back into the body. Same ideas we've already seen in the small intestine, reabsorbing things into the body. And so that's why you want to maximize that surface area to help reclaim things back into the body. So things like electrolytes that you need, sodium and potassium that those things you need, and lots of water. Most of the water will come back into the body. Okay, so that's the functional significance of those microvilli and the functional significance of the simple cuboidal epithelium. Okay, on to the loop of Henle. Now, the loop of Henle does something that you'll learn in physiology if you go there, called the counter current multiplier system. And the function of that is to make sure that bring as much water back into the body, make the urine very concentrated, bring the water back in. And so the structure of the loop of Henle is very important for how that works. So in the loop, notice that it goes into the medulla. Okay, so it goes down into the medulla, and it has two limbs. We have the descending limb first, then it does a little hairpin turn, and then the ascending limb next to it. Okay, so you have two kind of loops down, and they're going to be flowing right next to each other, and they're going to be running in opposite directions. Okay, so what happens here is they create a very salty environment, and that helps draw the water back out. I'm not going to ask you questions about the countercurrent multiplier system, but you might want to be thinking about that for later. For now, you just need to know the descending limb, the ascending limb, and the fact that the ascending limb has a thicker layer, which is the thick segment of the ascending limb. This part right here, that's nice and fat. And the reason it's thicker is it has a different tissue type. This one is simple squamous epithelium. This one has the simple cuboidal epithelium. Okay, so I think I have a picture of that. Okay, so here, simple squamous epithelium in the thin segment here, which is mostly descending limb. And then you have the simple cuboidal epithelium in the ascending limb right there. That's why they draw with two thicknesses. Okay, so let's talk about two different types of nephrons. And the type of nephron depends upon how long their loops are. Okay, so the first is called the cortical nephrons. And the cortical nephrons are called that because they're primarily located in the cortex. So they'll have, here's their proximal convoluted tubules, there's their little loop of Henle, and the loop of Henles are short, so they're not going to go into the medulla very much. Okay, so for the cortical nephrons, they're going to be surrounded by the peritubular capillaries. So there's your peritubular capillaries, which predominantly surround the proximal and the distal convoluted tubules. And so they're mostly found on the cortical nephrons in the cortex. Okay, then we have the juxtamedullary nephrons. Now, if you know the word juxta just means next to. So for example, you ever heard the term like you juxtapose, or it just means you put things next to each other. Okay, so juxtamedullary just means that the nephron is next to the medulla. So it's going to be right near the boundary between the cortex and the medulla. And the thing that's really significant for these nephrons is that they have a very long nephron. And remember that the nephron, the function of that nephron, very long loop, nephron loop or long loop of Henle. They have a very long loop of Henle. And remember that that's important because the loop of Henle is extremely useful for reabsorbing more water. Okay, so to help with that function, it has a specialized capillary bed surrounding that extra long loop of Henle. That's called the vasa recta. So just to summarize, the peritubular capillaries will surround the distal and the proximal convoluted tubules, and they're going to be found on the cortical nephrons that have the short loops. And then the vasa recta is going to be found on the long loop of Henles, which are going to be in the medulla, super kind of sticking out into the medulla, and those are going to be found on the juxtamedullary nephrons. Okay, collecting ducts. So I want to just real quick follow the path of the urine. Okay, so here we filter everything out. It traveled from the proximal convoluted tubule down into the loop of Henle, up through the distal convoluted tubule, and then that's going to dump it into the collecting duct. And as you see in this picture here, the collecting ducts are going to run through the medulla. And more specifically, they're going to run through the pyramids of the medulla. Okay, so if you're looking at here is the collecting ducts, and the collecting ducts are going to connect to lots and lots of different nephrons. So lots and lots of different nephrons are going to come all together and dump into a common collecting duct, and then you've got bunches and bunches of common collecting ducts running through the pyramids. Okay, so in this picture they're only showing you one collecting duct, but if you look at the texture in the pyramids of a kidney, so looking at this kidney, here's the cortex, there's the medulla. These are the renal pyramids, and renal pyramids, even on models and everything, they're always going to show you that striped appearance because it really does have that texture. You got a whole bunch of collecting ducts running through the pyramids, and those collecting ducts make that stripe appearance of the renal pyramids. Okay, and then at the very, very tip of the renal pyramids, that's called the papilla of the pyramid. You'll need that for lab. Oh, here it is. So the papilla of the pyramid, or the renal papillae right there. Okay, so let's talk just a little bit about the urinary bladder. So the urinary bladder, its major function is to store urine until you have the chance to pee it out. So here we have the ureters connecting. Notice that the ureters don't connect to the top of the bladder. Instead, they connect to kind of halfway down. And so what happens is as they connect, they create this triangular region. This triangular region between the ureters and the urethra, that's called the trigon. Trigon. Okay, so here is the trigon of the bladder there. Let's also talk about the function of the urinary bladder. So remember, the urinary bladder is to store urine, so it needs to expand and expand and expand. Kind of similar to what we already saw in the stomach, right? Expansion. Okay, so see these folds right here? What are those folds in the mucosa of the stomach called? Those are called rugae. Okay, so we're going to see the rugae inside the bladder. It also has a very specialized mucosa lining. Okay, so it has a special type of epithelial tissue that is only found in the bladder. Do you remember what that was? Starts with a T. Transitional epithelium. Why is it called transitional? It's going to transition, which means that it changes. And so if you look at it at the transitional epithelium when the bladder is not empty, when it's empty, so it's not stretched, okay, so not distended, just relaxed, here's what they look like. Oops. Remember, they have those very distinctive plump round cells at the top, and that's what helps you distinguish it from stratified squamous epithelium. Okay, those plump cells at the top. And so what happens is as they stretch, those plump cells are going to roll past each other. So they're going to go from stratified more towards simple, and they also change their shape too. Okay, so it changes, and that's why it's called transitional epithelium. Okay, so this is what it's going to look like. This is what it looks like when it's relaxed. Okay, so when it hasn't been pulled tight. But as the bladder fills more and more and more, they're going to roll past each other and flatten out. And so you end up with something that looks a lot more like simple squamous epithelium instead of something that has a bunch of layers. So it changes. Both the number and the shape of the cells changes. And that's why you have to call it transition, because you can't use the normal naming scheme. Okay, so that's one thing that allows it to expand. And again, the other thing is those big giant folds in it. So as the urine fills up the bladder, those folds will flatten out, and those are called rugae, just like you saw in the stomach. Okay, so what I really suggest that you do is to try to follow the path of the blood. So not just what I did in lecture, but also continue into the nephron. So from the cortical radiate arteries, how do you get into the nephron? What do you go while you're in the nephron? And then how do you come back out? And then after that, I'd like you to try to follow the filtrate. So starting with the glomerular capsule. So from there, follow all of the tubes, okay, into the collecting ducts. From the collecting ducts, travel through the pyramids. From there, you know, what are the specific structures within the larger structures within the kidney, all the way into the ureter, from there, all the way out, okay? The whole way through. And if you can do that and name all those structures, you'll be in excellent shape. Okay, that's that. I'm stopping now. Bye.